I'm truly glad to be able to come to you today and give you just an overview of some good news about the virus. And of course, we'll discuss the continued challenges, and there's lots of bad news. So I'm not pretending it doesn't exist, but I want to give everybody some updates that will give us some hope that we're starting to move in the right direction despite the obvious challenges and unconscionable death that still are ahead of us. So, first of all, the IHME model, which is one of the top models currently being monitored and updated daily, has moved the peak in terms of deaths in the United States up from April 16th to April 12th. That's now just 4 days away. The peak day previously was expected to have 3,000 deaths in one day in the United States. That number has dropped up by almost a third to 2,200. Still horrifying, but one third lower than it was expected to be. Now, importantly, the peak is not really a single day, it's more of a plateau. And that plateau is expected to run from today. We are essentially in that peak plateau right now, from today until close to the end of the month. But the latest prediction is that deaths will start to decline in the United States just 4 days from now, roughly. The peak is going to come on a different day in different states: California, New York, Massachusetts, other places. But that is, in general, good news. We are closer to getting over the hump than we previously believed. Number two, another bit of good news. Once the data from the last few days was added to the model, the expected death toll of this first wave of coronavirus has dropped to 60,000. Now, that's a crazy number of people. But last week, the model predicted 93,000 deaths in the first wave in the US. Earlier this week, the model predicted 82,000. That number has now dropped an additional sort of 27-ish% to 60,000 deaths. A terrible number, but a reduction of almost 50% since or 35-ish, 35, 40% since the prediction was 93,000. Now, why do I keep saying the first wave? Really important to understand this. Some models have a death toll prediction that is for what are expected to be 3 waves of infection. This model is looking just at the first wave right now. Doctors and scientists believe we are currently in wave 1. We will fall off of that wave in May, June, July. In the fall, there will be another peak, which is wave 2. And then in 2021, there would be a third wave, which is wave 3. Hopefully by then we would be well prepared to really mitigate, but that remains to be seen. This wave may end up with a far lower death toll than we thought, which would be because of what we are doing. I'll get to that in a moment. One other bit of good news, Avigan. I told you about Avigan weeks ago, maybe a month ago. It's one of the possible treatments that's being explored for coronavirus. We are now starting a clinical trial of Avigan, a Japanese drug, right here in Boston. Trump won't stop talking about chloroquine. Chloroquine has some promise, but recent studies are not super auspicious. I previously told you about Avigan. It is showing promise, and it's going to be tested in Boston across a few hospitals. Another bit of really good news is that New York hospitals have been starting to discharge more patients than are having intakes that are being brought in over the last few days. New York is a huge hotspot. Right now, 35% of all official cases in the country are in New York State. If you include New Jersey, New York, New Jersey have 47% of all of the official cases. It's a very good sign that things are starting to level out there. Other states have to keep it up in terms of distancing. Now, remember, anytime that things look better than expected, a whole bunch of people will say, "We told you, you were overreacting. We can stop the social distancing." This is a virus. It spreads virally. That's where the word comes from. If what you are doing works, it should feel like you overreacted. If you're doing the right thing, it should feel like you're doing too much for the level of spread because you have to be ahead of the curve. Anti-vaxxers will often say, we don't really need vaccines because measles is so rare. A lot of these conditions are so rare. They are rare because of the success of the vaccines. If we reduce deaths, as the model suggests we are doing, it's because we were staying home and closing things down, not despite it. It's still going to be tough. We currently have about 13,000 deaths in the US. If we believe the model and we will end up somewhere just under 61,000, what that means is that 80% of the death is ahead of us, mostly in the next 4 to 6 weeks. This is really tough. Let's stay in this, keep pushing on treatment, keep moving the vaccine forward, keep being responsible. And by the end of the week, I'll be able to further update you about where the numbers are. Check this out. The first 500 people who see this video and go to davidpakman.com/skill will get a premium membership to Skillshare for 2 months completely free. Skillshare is the online learning community with thousands of classes on almost anything you can imagine, always taught by experts. They have classes on drawing, painting, photography, video editing, web design, running a small business, and much more. I recently took a very interesting class called Simple Productivity, How to Accomplish More with Less, and got a bunch of great personal productivity tips out of it. We should allow ourselves a little time every week to either get creative, keep your brain sharp, learn something new. It's great for mental health, and almost all the classes are under an hour, so it's very easy for someone who's busy to take advantage of it. With Skillshare, you can discover a new passion, explore something you didn't know you would enjoy, but there's also plenty of classes for people with experience, so you can just get better at something you're already good at. And again, the first 500 people who see this video and go to davidpakman.com/skill will get a completely free premium membership for 2 whole months, giving you access to every class Skillshare offers. Check it out. I put the link right underneath this video.